Question. After a patient experiences a motor vehicle accident and suffers a complete spinal cord injury to L3, the nurses would assess for loss of motor function in the A. abdomen, B. arms, C. legs, D. chest. Explanation. Choice C is correct. The level of injury in the spinal cord correlates with innervation on the skin according to the level of the dermatim. Choice O is incorrect. Innervation of the abdomen corresponds to T9 to T12 injury. Choice B is incorrect. Innervation of the arm correlates with C5 to T1. Choice D is incorrect. Injury to T1 T8 correlates with chest innervation. Question. The nurse is caring for a post-stroke client when suddenly, she notes that the client has a fixed and dilated pupil. What would be the most appropriate action by the nurse? A. Reduce environmental stimuli. B. Reassess after 10 minutes. C. Check the client's blood pressure. D. Notify the physician. Explanation. Choice D is correct. The client is manifesting signs of increased intracranial pressure. This situation warrants immediate medical intervention to decrease the ICP. The nurse needs to notify the physician immediately. Choice O is incorrect. A fixed and dilated pupil signifies an increase in ICP. Reducing environmental stimuli is not an appropriate intervention at the time. Choice B is incorrect. There is no need to reassess after 10 minutes as this warrants immediate attention from the healthcare team. Choice C is incorrect. Checking the client's blood pressure is unnecessary. Question. The leading and single most important indicator of the intensity and presence of pain is A. Quantitative assessment/measurement of pain with a pain intensity scale. B. The client's reports of pain to the nurse and other healthcare providers. C. A qualitative assessment/measurement of pain with a pain intensity scale. D. The nurse's observation and assessment of pain behaviors, such as guarding and moaning. Explanation. Choice B is correct. The leading and single most crucial indicator of the intensity and presence of pain is the client's reports of pain to the nurse and other healthcare providers. Too often pain is undertreated because we fail to listen to the client and their self-reports of pain. Instead, we regularly assess and evaluate client vital signs and pain behaviors, which are less accurate and reliable than the client's reports. Choice O is incorrect. Although a quantitative assessment and measurement of pain with a pain intensity scale can and should be used, this is only one way to obtain the subjective client's reports of pain. Choice C is incorrect. Although a qualitative assessment can and should be used, this is only one way to obtain the subjective client's reports of pain, including its description and characteristics. Choice D is incorrect. Although the nurse will observe and assess pain behaviors such as guarding and moaning, this is not the leading and single most important indicator of the intensity and presence of pain. Question. The nurse is caring for a patient with a T5 spinal cord injury. Which assessment information would indicate to the nurse that the patient is experiencing autonomic dysreflexia? A. Distended bladder. B. Headache. C. Hypertension. D. Generalized pallor. Explanation. Choice B is correct. Autonomic dysreflexia is a severe, uncompensated cardiovascular reaction that occurs in response to visceral stimulation after spinal shock has resolved. Patients with spinal cord injuries at T6 or above are at risk of developing autonomic dysreflexia. A sudden, throbbing headache is one of the most important warning symptoms that a patient is experiencing this life-threatening condition. Choice O is incorrect. Bladder or rectum distension is the most common cause of autonomic dysreflexia, not a symptom experienced as a result. In addition, bladder distension could indicate a number of other issues, and would not be specific to autonomic dysreflexia. Choice C is incorrect. Autonomic dysreflexia is associated with an elevation in blood pressure and/or reduction in heart rate, not reduced blood pressure. Choice D is incorrect. Autonomic dysreflexia causes flushed face and upper chest above the level of the lesion and pale extremities below the level of the lesion, not generalized paleness over all areas of the body. Question. The nurse is evaluating the progress of a completely paraplegic female client with a C6-C7 spinal cord injury. Which indicator signifies that the client is improving in physical therapy? A. The client can control the motorized wheelchair. B. The client states she wants to stand up with assistance. C. The client says she wants to move her toes. D. The client says she regained her bladder control. Explanation. Choice A is correct. A C6-C7 spinal cord injury (SCI) can still retain some ability to extend shoulder, arms, and fingers with compromised dexterity in the hands and fingers. The client showing that she can maneuver a wheelchair indicates that she has progressed in therapy. Rehabilitation often will focus on learning to use the non-paralyzed portions of the body to regain varying levels of autonomy. Upon successful treatment, survivors of injuries at the C6/C7 level may be able to drive a modified car with hand controls. The C6 and C7 cervical vertebrae and the C8 spinal nerve form the lowest levels of the cervical spine and directly impact the arm and hand muscles. The C6/C7 injury has the potential to change everything below the top of the ribcage, resulting in quadriplegia or paraplegia. Physical therapy is an essential part of recovery. The patient will need to maintain any function not lost by the cord damage, as well as try to regain function. In acute rehabilitation of C6/C7 SCI patients, the focus is on strengthening the upper extremities to the maximal level in patients with complete paraplegia. Empowering exercises for shoulder rotation are proposed for using crutches, swimming, electric bicycles, and walking. At the end of the acute phase, strong upper extremities are needed for the independent transfer from the bed. For this purpose, active and resistance exercises to strengthen the muscles of the upper extremity should be initiated at the earliest possible period. The wheelchair is an essential tool for SCI patients to be mobile and participate in social life. Choices B and C incorrect. A client with C6-C7 spinal cord injury with complete paraplegia loses control over leg and foot movement completely. These statements by the client indicate that she may need counseling regarding coping with her injuries. Choice D is incorrect. The client who loses control of their bladder may regain function again sometime after injury. However, this is not dependent on physical therapy and does not indicate a positive response to physical therapy. Question. The nurse is taking care of an 8-hour post-operative spinal surgery client. What should be the priority nursing intervention for the client? A. Assess how much opioid analgesics the client is using via the patient-controlled analgesia peaker pump. B. Log-roll the client with 3 staff when turning the client from side to side. C. Assist the client in ambulating to the bathroom. D. Place pillows under the thighs of each leg when the client is in the supine position. Explanation. Choice B is correct. Log-rolling the client is a priority to maintain proper body alignment and prevent injury to the spinal cord. Choice A is incorrect. The peaker delivers a fixed amount of analgesic to the client every time he presses the button. The priority of the nurse should be to prevent spinal cord injury to the client. Choice C is incorrect. The client is in the first 24 hours post-surgery and should be on bed rest. Ambulation is not a priority at this time. Choice D is incorrect. The client can put pillows under his client's legs to increase comfort. However, the priority nursing diagnosis is to prevent post-operative complications. Question. Select an appropriate nursing diagnosis for your client who is affected with hyperalgesia. A. At risk for inadvertent narcotic overdoses related to hyperalgesia. B. At risk for abnormal and irreversible pain related to hyperalgesia. C. At risk for somatic pain related to hyperalgesia. D. At risk for visceral pain related to hyperalgesia. Explanation. Choice B is correct. At risk for abnormal and irreversible pain related to hyperalgesia is an appropriate nursing diagnosis for a client who is affected with hyperalgesia. Hyperalgesia, which is synonymous with hyperpathia, is abnormal pain processing that can lead to the appearance of neuropathic pain that is irreversible if left untreated. Choice A is incorrect. At risk for inadvertent narcotic overdoses related to hyperalgesia is not an appropriate nursing diagnosis for a client who is affected with hyperalgesia. Hyperalgesia is abnormal pain processing that is not associated with inadvertent narcotic overdoses. Choice C is incorrect. At risk for somatic pain related to hyperalgesia is not an appropriate nursing diagnosis for a client who is affected with hyperalgesia. Hyperalgesia can lead to neuropathic pain, but not somatic nociceptive pain. Choice D is incorrect. At risk for visceral pain related to hyperalgesia is not an appropriate nursing diagnosis for a client who is affected with hyperalgesia. Hyperalgesia can lead to neuropathic pain, but not visceral nociceptive pain. Question. You are a home health nurse caring for an elderly client in her home. She has children and grandchildren. However, they live far from the couple and they typically visit only once or twice a year. The client is beginning to show some signs of Alzheimer's. The husband is 88 years old and had a stroke that left him with right-sided weakness. What support should you give the husband in terms of caring for his wife? A. You should advise the couple to move closer to their children so that they can care for their father. B. You should teach the husband about the progression of Alzheimer's and the need to promote as much independence as possible. C. You should teach the husband about this progressive disease and the need to do all that he can for his wife to help prevent anxiety and depression. D. You should advise the couple to decrease their social activities in order to preserve the wife's dignity and self-esteem. Explanation. Choice B is correct. You should teach the husband about Alzheimer's and the need to promote as much independence as possible. Adults diagnosed with dementia are faced with a disease that is irreversible and progressive. The loss of judgment, reasoning, memory, and communication skills leads to an inability to discern risk and danger. Dementia can limit a person's ability to live independently, which can be very distressing for the individual and family members. Caregivers need to embrace a patient-centered approach that allows people with dementia to maintain as much autonomy and control as possible while still preserving their safety. Choice O is incorrect. Moving closer to the children may not be appropriate advice, mainly if the children are unable or unwilling to care for their mother. Choice C is incorrect. Clients with Alzheimer's disease and other disabilities, including physical disabilities, should be coached and encouraged to be as independent as possible. Choice D is incorrect. The couple should be advised to continue their social activities. Question. You are working with older adults in the clinic. The 80-year-old woman is brought to the clinic by her family with fever and changes in her mental status. When attempting to differentiate between delirium and dementia, you know that delirium is characterized by which of the following? Select all that apply. A. Abrupt onset. B. Change in psychomotor activity. C. Irreversible. D. Lasts for months to years. Explanation. Choices A and B are correct. An acute illness, fever, sepsis, infection typically causes delirium, so delirium often has an abrupt onset. Choice A with rapid progression. There are significant changes in activity resulting in hyperactivity or hypoactivity. Choice B. Delirium is typically reversible when the underlying illness is resolved. Delirium typically lasts for hours to days, whereas dementia lasts for months to years and is usually irreversible. Choices C and D are incorrect. These two characterize dementia. Dementia has a variety of causes with gradual changes in mentation. In dementia, psychomotor changes occur later in the disease, speech is sparse and may progress to mutism as the disease advances. Question. The nurse is assessing a patient's neurological status and notes 4+ deep tendon reflexes DT. Which of the following conditions would not be a possible cause of hyperactive DTRS? A. Hypercalcemia. B. Muscular dystrophy. C. Upper motor neuron lesion. D. Hyperthyroidism. Explanation. Choice B is correct. Hyperactive deep tendon reflexes DTRS would not be expected in a patient with muscular dystrophy. Muscular dystrophy DTRS are typically decreased or absent. Choice O is incorrect. Hypercalcemia, low calcium level, is a potential cause of hyperactive DTRS. Choice C is incorrect. The presence of an upper motor neuron lesion is a potential cause of hyperactive DTRS. Choice D is incorrect. Hyperthyroidism is a potential cause of hyperactive DTRS. NCSBN client need topic skills/procedures, subtopic potential for complications from health alterations, system-specific assessments. Question. The nurse has just finished assisting the physician in applying a fiberglass cast to a patient with a severe ankle sprain. The patient inquires about the timing that he will have to wait until he can walk on the cast. How much time until the patient can walk again? A. 8 hours. B. Half an hour. C. After 24 hours. D. After 48 hours. Explanation. Choice B is correct. A fiberglass cast fully dries within 30 minutes, half an hour of application. The patient can walk bare weight on it if allowed by the physician after 30 minutes. Choices A, C, and D are incorrect. The client may bear weight, if permitted by a doctor, on his cast once it is fully dry. A synthetic fiberglass cast fully dries after 30 minutes. A plaster cast takes 2 to 3 days to completely dry. Question. A client with a history of long-standing hypertension and hyperlipidemia is complaining of shortness of breath and weakness in the legs. Which of the following may be occurring? A. The patient may be having a heart attack. B. The patient is exhibiting signs of pulmonary embolism. C. The patient may be experiencing the onset of peripheral vascular disease. D. The patient is developing chronic obstructive pulmonary disease. Explanation. Choice A is correct. Myocardial infarction may present with symptoms of shortness of breath and muscle weakness. Silent MI is something that may not occur with pain. Other symptoms of myocardial infarction include chest discomfort. Most heart attacks involve pain in the center of the chest that lasts more than a few minutes, or it may go away and then return. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Discomfort in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, back, neck, fore, or stomach. Shortness of breath can occur with or without chest discomfort. Other signs include breaking out in a cold sweat, nausea, or lightheadedness. Since hyperlipidemia has no symptoms, it can cause damage before an individual realizes there is a problem. It can cause atherosclerosis and limit blood flow, increasing the risk of heart attack or stroke. Factors that can increase your risk of bad cholesterol include a poor diet, including foods that are high in saturated fat found in animal products, and trans fats found in some commercially baked products, can contribute to an elevated cholesterol level. Additionally, obesity, lack of exercise, age, and history of diabetes can increase the chances of experiencing hyperlipidemia. Hypertension is often referred to as the silent killer because some people do not experience any significant symptoms until their blood pressure is extraordinarily elevated, or if symptoms such as headache, palpitations, and dizziness become bothersome. It is a significant public health problem and an essential area of research due to its high prevalence, as well as a significant risk factor for cardiovascular diseases and other complications. The combination of hypertension and hyperlipidemia can result in several harmful health consequences. Choice B is incorrect. While a pulmonary embolism can present with shortness of breath, it is essential to correlate the answers with risk factors present in the question. Hypertension and hyperlipidemia. Hypertension and hyperlipidemia are not necessarily risk factors for. Choice C is incorrect. While peripheral vascular disease can present with weakness and leg pain, it does not cause shortness of breath. Choice D is incorrect. While COPD can present with shortness of breath, it is not associated with hypertension and hyperlipidemia as risk factors. Question. What is the correct documentation of the patient's peripheral pulse when the finding is that the posterior tibial pulse is weak and thready? A. Grade C posterior tibial pulse. B. Posterior tibial pulse is grade B. C. The client's posterior tibial is 2. D. Posterior tibial pulse is 1. Explanation. Choice D is correct. When assessing pulses, the strength, volume, and fullness of the peripheral pulses are categorized and documented as follows. 0. Absent pulses. 1. Weak pulse. 2. Normal pulse. 3. Increased volume. 4. Abounding pulse. Question. While auscultating a client's bowel sounds, the nurse notes a swooshing sound to the left of the umbilical area. What would be the nurse's initial priority action? A. Percuss over the area to assess for dullness. B. Notify the physician. C. Gently palpate the abdomen to assess for tenderness. D. Ask the patient about recent bowel movements. Explanation. Choice B is correct. The nurse should suspect this client is presenting with an abdominal aortic aneurysm due to the bruit or swooshing sound upon auscultation. The nurse should immediately notify the patient's healthcare provider of this urgent situation. Rupture can occur spontaneously or with trauma. If the aneurysm bursts, it may cause life-threatening bleeding. The aneurysm should be assessed immediately to determine the need for cervical intervention. Choice O is incorrect. If a bruit is heard upon auscultation of the abdominal aorta, the nurse should suspect an aneurysm and should not perform percussion due to the risk of rupture. Choice C is incorrect. If a bruit is heard upon auscultation of the abdominal aorta, the nurse should suspect an aneurysm and should not perform palpation due to the risk of rupture. Choice D is incorrect. This action would be appropriate for assessing the patient's gastrointestinal system, but would not be the highest priority for a suspected aneurysm. Question. You are attending to a male client who is postoperative day 1 following mitral valve replacement. He is getting ready to ambulate for the first time. His heart rate is 102 beats per minute and the stroke volume based on the echocardiogram is 72 milliliter. Which of the following represents his cardiac output? I 7.344 liter per minute. B 30 liter per minute. C 55%. D 73.444 liter per minute. Explanation. Choice A is correct. To answer this question correctly, you must know the right formula for cardiac output. CO equals heart rate x stroke volume. Heart rate is measured in beats per minute, and stroke volume is measured in milliliters ml. The HR is simply the number of times per minute that the heart beats, whereas the SD is the ml of blood that the heart pumps out with each contraction. By multiplying the two together, you get how many ml of blood the heart is pumping out each minute. This is the cardiac output. Cardiac output is usually reported in liters per minute. The average is about 5 liter per minute, but varies greatly depending on the size of the patient. A decreased cardiac output, low output failure, is seen in congestive heart failure. A high cardiac output state refers to resting cardiac output more significant than 8 liter minute. An increased cardiac output high minus output failure may be seen in hypothyroidism, vitamin deficiency, and severe uncorrected anemia. For this problem, cardiac output equals 102 beats per minute HR, x 72 milliliter, SD equals 7,344 milliliter per minute or 7.344 liter per minute. Choices B, C, and D are incorrect. Choice C appears to represent an ejection fraction, which can be obtained from an echocardiogram. Cardiac output should not be confused with ejection fraction. Ejection fraction is a fraction and is often reported as a percentage%. Left ventricular ejection fraction is the amount of blood pumped out of the left ventricle during a systole. An ejection fraction of 55% means that 55% of the total amount of blood in the left ventricle is pumped out with each heartbeat. The normal is 55% to 70%. Ejection fraction is decreased in systolic heart failure, whereas it remains normal in diastolic heart failure. Question. A 28-year-old male arrives at the emergency department for midsternal chest pain, shortness of breath, and nausea that began suddenly 20 minutes ago. He has no medical history and reports he uses cocaine every once in a while. What cardiac rhythm will the nurse suspect to see? A. Normal sinus rhythm. B. Bradycardia. C. SD elevation. D. Third-degree heart block. Explanation. Choice C is correct. Cocaine increases the effects of the sympathetic nervous system and exaggerates or causes cardiovascular disease. The nurse may see cardiac dysrhythmias, such as ventricular tachycardia or ventricular fibrillation, and can see myocardial infarction as well. Choice O is incorrect. The nurse may see a normal sinus rhythm, but because of the symptoms of chest pain, shortness of breath, nausea, and use of cocaine, the nurse will most likely see an SD elevated myocardial infarction STEMI, which is an indication of a heart attack. Choice B is incorrect. Cocaine increases the effects of the sympathetic nervous system, which will increase heart rate, respirations, diaphoresis, and raise blood pressure. Bradycardia is not likely to be seen. Choice D is incorrect. The patient may already have a third-degree heart block coincidentally, but a STEMI is most likely to be seen in this patient. Question. The nurse is caring for a patient post-coronary artery bypass graft. The nurse is implementing Measures to address the nursing diagnosis: ineffective airway clearance related to retained secretions and excess secretions. Which nursing intervention is the least appropriate? A. Administering aspirin prior to deep breathing and coughing exercises. B. Splinting the incision site with heart pillows or pillows before coughing. C. Assisting the client to ambulate as tolerated. D. Teaching the client the correct use of an incentive spirometer. Explanation. Choice C is correct. The EKG strip shows normal sinus rhythm with occasional premature ventricular contractions. A PVC produces wide, bizarre complexes with the P wave hidden within the QRS complex, not visible. Choice O is incorrect. Cardiozation would not be appropriate for this rhythm. Synchronized cardiozation delivers a timed electrical current to reset the heart's electrical activity, and is indicated in tachydysrhythmias such as atrial fibrillation or atrial flutter. Choice B is incorrect. Atropine is indicated for increasing the heart rate, such as in the case of symptomatic bradycardia. This client's rhythm is 80 bpm, so it is within the normal rate and does not require adjustment. Choice D is incorrect. This client may notice or feel palpitations due to the intermittent irregular beats, but this assessment data would not be an important aspect of determining the need for treatment, and would not be a high priority. Additional information. PVCs are the most common type of arrhythmia, can occur in healthy individuals, and are typically not concerning in an otherwise normal rhythm. However, they can be a warning sign of electrolyte imbalance, hypokalemia, hypomagnesemia, hypoxemia, acid-base imbalances, or myocardial ischemia. PVC may also be triggered by excessive stress, caffeine use, nicotine, and sleeplessness. The nurse should assess the client's presentation and review the most recent lab values to determine if there is any apparent physiological cause for the arrhythmia. If the client presents without symptoms and if no abnormal labs are noted, the nurse should continue to monitor for any symptom development or changes in the rhythm. Question. A client is being discharged following the insertion of a permanent pacemaker. Which of the following should be included in the client's discharge instructions? A. Air travel will not be possible due to airport screening equipment. B. You will need to discard any radios at home that have antennas. C. Computed tomography scans are not permitted with this device. D. You should use your cellular phone on the opposite side of the generator. Explanation. Choice D is correct. For a client with a pacemaker, it is recommended that they talk on their cellular phone opposite of the pulse generator to prevent electromagnetic interference. Choices A, B, and C are incorrect. Air travel is not prohibited for a client with a pacemaker. They should carry their medical alert card in the event they are stopped by airport security. Discarding radios and other home appliances are not necessary, as they do not cause any interference. CT scans are permitted for a client with a pacemaker. Diagnostics with an MRI are contraindicated. Additional information. Following the placement of a pacemaker, the client will be provided with the following instructions. Keep a pacemaker identification card in your wallet. Following the procedure, avoid lifting your arm over your head for 4 weeks. Do not lift heavy objects following the procedure until cleared by your primary healthcare provider. Taking a bath and shower is not restricted. Do not apply pressure over the generator, and do not wear any tight clothing. Operating household appliances would be considered safe. Question. You are educating a patient newly diagnosed with hypertension about sodium and its role in blood pressure. Which of the following statements about sodium are true? Select all that apply. A. Sodium cannot be completely eliminated from the diet. B. There is no sodium in fresh fruits and vegetables. C. Canned vegetables should be avoided. D. The body needs some sodium as it plays an important role in water balance. Explanation. Choices A, C, and D are correct. O is correct. It is not possible to eliminate sodium from the diet, nor would it be recommended. Sodium is a principal cation, and it plays a role in driving the sodium-potassium pump as well as regulating water balance, so wholly eliminating sodium is not a good idea. C is correct. Canned vegetables do use a large amount of sodium to preserve flavor, so you should advise your patient with hypertension to avoid them. D is correct. The body indeed needs some sodium as it plays a vital role in water balance, so this is an appropriate teaching point for your patient. Choice B is incorrect. There is a small amount of sodium in fresh fruits and vegetables, but these are still good diet choices for a patient newly diagnosed with hypertension. Question. The nurse is caring for a patient post-coronary artery bypass graft. The nurse is implementing measures to address the nursing diagnosis ineffective airway clearance related to retained secretions and excess secretions. Which nursing intervention is the least appropriate? A. Administering aspirin prior to deep breathing and coughing exercises. B. Splinting the incision site with heart pillows or pillows before coughing. C. Assisting the client to ambulate as tolerated. D. Teaching the client the correct use of an incentive spirometer. Explanation. Choice A is correct. Aspirin is an NSAID that has an antiplatelet property. Administering aspirin to the patient may put the patient at risk for postoperative bleeding. The patient needs opioids to manage his pain, not aspirin. Choice B is incorrect. Splinting the incision site before coughing promotes more intense coughing efforts. Therefore, it is an appropriate nursing intervention. Choice C is incorrect. Respiratory effort is increased with ambulation, therefore, deep breathing occurs helping to clear chest secretions. Choice D is incorrect. The correct use of an incentive spirometer encourages sustained inspiration to open alveoli, promoting the clearing of chest secretions. Question. Which of the following rhythm changes will have an impact on cardiac output? Select all that apply. A. Supraventricular tachycardia. B. Sinus bradycardia. C. Ventricular tachycardia. D. Mobitz type 2 heart block. Explanation. Choices A, B, C, and D are all correct. All rhythm changes will affect cardiac output. This is especially important to remember when you are administering antiarrhythmics to your patient, as these medications and their effect will also change the cardiac output. There are two reasons that rhythm changes affect cardiac output. 1. They break your heart rate. 2. They change your stroke volume. Remember, CO equals HRXSV, so any change to either heart rate or stroke volume subsequently affects your cardiac output. A. Supraventricular tachycardia, SVT. There is an increase in heart rate, but a decrease in stroke volume. This is because the heart is beating so fast that there is not enough time for diastole and, therefore, not enough time for the atriums to fill with blood. This decreases preload, which decreases contractility due to Starling's law, which reduces stroke volume. Patients in SVT have decreased cardiac output. B. Sinus bradycardia. The heart rate is lower due to bradycardia, so the cardiac output is lowered. Remember, CO equals HRXSV decreased, HR equals decreased CO. C. Ventricular tachycardia. There is an increase in heart rate, and a decrease in stroke volume. This is because the heart is beating fast and irregularly. There is not enough time for diastole, and therefore, not enough time for the atriums to fill with blood. This decreases preload, which decreases contractility due to Starling's law, which reduces stroke volume. Patients in ET have decreased cardiac output. This is a lethal rhythm. D. Mobitz type 2 heart block. This type of heart block causes a decreased heart rate, which once again decreases cardiac output. CO equals HRXSV decreased, HR equals decreased CO. Patients in Mobitz type 2 heart block have decreased cardiac output.